It is my pleasure at this point to begin the webinar by introducing Dr. Jose Fernandez, the Deputy Director of the Office of Pandemic and Emerging Threats, Office of Global Affairs, in the U.S. Department of Health and Human Services, who will be leading us off in this webinar. Thank you, Jose.
All right, thanks so much, Julie. And I'll add my my welcome. Good morning, good afternoon, good evening, everyone. Very much looking forward to the discussions today, and it's wonderful to have everyone here with us. We're absolutely honored and grateful to all of our esteemed guests for joining us to share their unique perspectives on the Pandemic Fund and their reflections on the second call for proposals. The global financing landscape certainly evolved significantly since the Pandemic Fund's launch back in November of 2022. And the challenges exposed by recent health emergencies remain quite stark. The need for resilient health systems, sustainable financing mechanisms, and stronger collaborations between the health and finance sectors, all of these are more urgent than ever. The Pandemic Fund continues to demonstrate its catalytic potential. With $2 billion in seed capital from 27 donors, it has allocated a total of $885 million in grants benefiting 75 countries. These grants have unlocked an additional $6 billion in co-investments, demonstrating a strong government and partner commitment to pandemic preparedness. Additionally, $129 million was fast-tracked to support 10 countries facing the ongoing Mpox public health emergency, which highlights the fund's ability to be responsive to both long-term and acute needs. Despite these successes, though, demand continues to outpace the resources. The first and second calls for proposals saw many strong, technically sound proposals that could not be funded, highlighting persistent resource mobilization challenges. And as we prepare for future calls, innovative approaches to mobilize additional financing and diversification beyond official development assistance will be critical. The amended international health regulations adopted earlier this year provide a new framework to guide coordinated action, and key amendments include the inclusion of equity provisions, a coordinating financing mechanism, and strengthened accountability measures as well. This coordinating financial mechanism has the potential to bridge gaps and foster alignment amongst donors, governments, and implementing entities, ensuring that limited resources are utilized effectively. There is great potential for collaboration between GHSA and the Pandemic Fund. Sustainable financing for preparedness requires that health and finance sectors work together to prioritize investments, align priorities, create more fiscal space, and build trust. And since its inception, the GHSA Sustainable Financing for Preparedness Action Package has championed this collaboration, offering platforms for countries to share actionable experiences and advocate for robust health security financing. Today's webinar builds on the insights from our last series on the Pandemic Fund, where representatives from Pakistan, Senegal, CARFA, and Rwanda shared how they coordinated across sectors, prioritized activities for funding, and galvanized political and financial commitments. These discussions also highlighted how GHSA's 2028 target, a global goal for accelerating IHR implementation, complements the Pandemic Fund's own efforts. By the end of 2023, 54 countries had met the target of achieving demonstrated capacity in at least 5 technical areas as measured by the Joint External Evaluation, and another 17 countries were close to that. The Pandemic Fund's support for 75 countries to build capacities in the laboratory surveillance and human resources spaces will undoubtedly propel us towards the 2028 target and hopefully a safer world. GHSA Action Package working groups can further support countries, helping identify gaps in health security capacities, and importantly, providing technical resources for proposal, development, and implementation. Today, we're thrilled to welcome experts from South Africa, Lebanon, Honduras, and Ethiopia, each bringing valuable insights into their experiences with the Pandemic Fund, from proposal development to implementation. Their lessons learned and strategies for success will offer, hopefully, practical guidance to others preparing to engage with future calls for proposals. We encourage our audience here to engage actively during the question and answer session and share your thoughts in the chat. This is a great opportunity to exchange knowledge and strengthen our collective impact in pandemic preparedness financing. Our hope today is that this webinar will leave you with actionable insights into pandemic funds processes, from proposal development all the way through to implementation, but help really to foster greater collaborations among stakeholders. Together, we can ensure that the fund continues to fulfill its promise of strengthening global health security. With that, I want to turn things back to Julie, and I'm looking forward to hearing the discussions today. Thank you so much.
Thank you so much, Jose, for that very insightful introduction and a great beginning to the discussion. I want to introduce our next speaker, Priya Basu, who is the executive head of the Pandemic Fund Secretariat. Prior to her current role, Priya served as the head of the COVID-19 task force at the World Bank and led the bank's engagement on pandemic prevention, preparedness, and response in global fora, including the G20 and G7, coordinating across finance and health, and building on previous roles in which she managed a $21 billion portfolio of financial intermediary funds and trust funds administered by the bank to support global priorities such as financial inclusion, global health security, climate change, and debt relief. Priya, I am turning over to you and invite our participants during your presentation to please go ahead and identify any questions you might have in the chat. If we have a few minutes, we will be taking questions at the end of Priya's presentation, and you may either do that by putting your questions in the chat, and the moderators will recognize and ask them, or if we have time, raising your hand following each session when there's Q&A, using either the raise hand function in Zoom or by appearing on camera to let us know if you'd like to speak. So, Priya, over to you.
Thank you so much, Abby, and good morning, good afternoon, good evening, everyone. It's a pleasure to join you to update you on the Pandemic Fund's second call for proposals, which is what I was asked to speak about. And it's wonderful to see so many colleagues, including colleagues from many of the countries that have received financing from the Pandemic Fund's second call. So let me, I have a few slides that if I could just ask someone to project those, please, that would be wonderful. I think, Abby, you have those slides, so.
I think, can I get Dawn to share the screen? Thank you.
All right, wonderful. If we can just move to the next slide, please. Okay, so yes, thank you. So as was mentioned in the introduction, the Pandemic Fund has moved forward very quickly. We were established, as you know, towards the end of 2022, formally launched in November 2022 on the margins of the G20 Health and Finance Ministers meeting in Bali, Indonesia. And already in December 2024, we've managed to create a footprint in over 75 countries by awarding grants of 885 million that have catalyzed over 6 billion in additional financing. And we have 47 active projects now across 6 geographical regions. That map on the right shows you where our projects are rolling out. And we've done this through 2 calls for proposals. The first call for proposals was in 2023, awarded in July 2023, and then the second round of funding was awarded in October of this year. Just as a quick snapshot, 43% of Pandemic Fund resources have been allocated for countries in Sub-Saharan Africa, which is the region with the highest demand. And in the second round, that is the one that was awarded in October, more than 50% of funds that were awarded went to Sub-Saharan Africa. And as was also noted in the introduction, we've managed to mobilize in the first instance, in its initial phase, Pandemic Fund was able to mobilize $2 billion from 27 donors, but we're now in the midst of a fundraising effort, and we had a pledging moment in Rio de Janeiro on October 31st this year, and our pledging will conclude in April. And through this, we have also some new donors who have joined the Pandemic Fund. So we're in the midst of raising another $2 billion by April 2025. Next slide, please. So, no, I think you skipped one. Yes. So this is just key milestones and achievements of the Pandemic Fund. As I mentioned, we were launched formally in 2022. Then first call for proposals was announced in March of 23, and then awarded in July of 23. We also had an independent stock-taking review that was conducted, which informed the design of the second round of funding, which was launched in February of 24, and then concluded in May of 24, and then was finally awarded in October of 24. And I also wanted to mention that we're just coming out of a board meeting of the Pandemic Fund that has taken place over the last 2 days, and the board has decided to announce a third call for proposals before the end of this month, and that third round will be allocated later next year. Next slide, please. So on the second call for proposals, because that's the topic of this discussion, as I understand, this, as I already mentioned, was awarded on October 17th of 2024, and now the projects under that second call are in the process of being rolled out. In fact, my team has been actively engaged with all 28 projects which have received funding under this second call, and I'll tell you a bit more about that. Next slide, please. So as part of the second call, while it was still ongoing, the projects had already been evaluated by the technical advisory panel, but money had not yet been allocated by the Pandemic Fund board. The world was faced by the Mpox outbreak, with Africa CDC declaring it as a public health emergency of continental security, and then shortly thereafter, the World Health Organization declaring Mpox as a public health emergency of international concern. That happened in August this year. So soon thereafter, the Pandemic Fund board decided to provide fast-track support for Mpox affected countries. Those countries had already submitted proposals to the Pandemic Fund. Those proposals had been already evaluated by the technical advisory panel. And so the board had an emergency meeting on early in September, and then another one on September 19th, at which it decided to allocate $129 million for 5 projects under the second round that were fast-tracked to benefit 10 Mpox-affected countries. And this slide just shows you how quickly and with the agility that the Pandemic Fund moved in order to be able to support these Mpox-affected countries. So within a period of 8 weeks, from September 19th to November 15th, all the work that was needed to help these countries was done. And then the projects are now, as of November 15th, all 5 projects are under implementation. And the countries are, we're in regular contact with them. And some of these projects, 3 of these projects are single country projects. So the ones for DRC, Burundi, and Rwanda. And then there are 2 multi-country regional entity projects as well. So a total of 10 countries have benefited from this fast tracking. Next slide, please. So now coming back to the other part of the second call for proposals, the second call, as I said, was awarded in October, but when we announced it and closed it in May, we saw 127 eligible applications that came in. They covered 132 countries, and the window or the envelope for the second call was 500 million. In response to that, we received 2.7 billion worth of proposals. So you can see the tremendous demand here, almost more than 8 times the envelope overall in proposals that were received, and many times oversubscribed, even in terms of the eligible proposals. And 74% of the applications that came in were from single country projects, and the remaining were either multi-country or regional projects. In terms of the priority areas that we had for the second call, we had announced that the areas that the Pandemic Fund would be prioritizing for this call, in line with the medium-term strategic plan, were surveillance, laboratories, and human resource strengthening. And on the left side, you can see that most of these proposals actually focused on all 3 areas. As you might know, the Pandemic Fund operates through 13 implementing entities. And you can see on the right side in that pie chart that 79% of the applications included 2 or more of these implementing entities coordinating together with the beneficiary country or regional entity. Next slide, please. So when you take a closer look at these eligible applications, I also wanted to highlight that they brought sizable co-financing, 7.6 billion worth of co-financing from international partners and 4.7 billion worth of co-investment. There was a good distribution across regions, but the bulk of the demand was from sub-Saharan Africa, as you can see. And in terms of the income groups, the pie chart shows you how these eligible proposals, the 127 proposals, were distributed across low income, lower middle income, upper middle income, and some small number for either eligible for IBRD eligible high income countries. Next slide, please. So once all these eligible proposals were screened, then they were passed on to the technical advisory panel. The Pandemic Fund has a technical advisory panel that's chaired by the WHO, which reviews and scores, evaluates and scores proposals, and the proposals are evaluated through a set of agreed criteria and a scorecard, which is shown here. All of this is available on our website, but essentially what they're looking for is the robustness of the scope and the objectives of these proposals, and to make sure that they're targeted at least at one of the 3 key areas of focus. Then the rationale needs alignment with national and regional priorities, the amount of co-financing and co-investment that they're bringing, ownership, commitment, coordination, collaboration, and then the implementation, monitoring, evaluation, alignment of these proposals with the results framework. And as a result of this evaluation, the technical advisory panel found identified over $1 billion of proposals as being of high quality. And so then those proposals were then put forward as candidates to receive funding under the second call, okay, bearing in mind that the envelope was 500 million and there were over $1 billion worth of high quality proposals. Next slide, please. So now coming back to MPOX, as I mentioned, some of these under the second call were fast-tracked for MPOX support. And these proposals, care was taken to ensure that they're well aligned with the WHO's draft MPOX Global Strategic Preparedness and Response Plan, as well as with the joint WHO Africa CDC Continental Plan. These projects included a single country project for the DRC, one for Burundi, one for Rwanda, a proposal for the Greater Virunga region that covered several countries, and then one for regional proposal for IGAD. And 128.8 million was awarded to these 5 projects, and then we worked very closely with the project teams to ask them how much of this funding was needed for the first 6 months, because as you will recall, the WHO Africa CDC Joint Continental Plan has a 6-month focus. And so each of the projects was asked to prepare a 6-month priority plan, identifying how much of the amount that was awarded to them from the pandemic fund could be absorbed in the first 6 months. And this included the grant from the pandemic fund, as well as the co-financing and co-investment that was coming in. And what we have as of now, and this is being continuously updated, but about 78 million of pandemic fund grants plus co-financing, co-investment will go towards the overall 6-month continental plan. Next slide, please. So now those were 5 projects, and then there were another 23 projects that were selected by the Pandemic Funds Board for grant funding under the second call. So a total of 28 projects were awarded funding under the second call for proposals. And these 23 projects were awarded financing based on a thorough set of criteria that the Pandemic Funds Board used for its allocation, looking at how grants are distributed across different types of proposals, making sure that the portfolio has a good distribution across different geographies, ensuring that there's a mix of lower middle income and upper middle income countries in the portfolio, with a priority given to low and lower middle income countries, and ensuring a good mix of implementing entities. Next slide, please. So as a result of this, on October 17th, following the fast tracking of the 5 MPOX projects, the Pandemic Funds Governing Board awarded 418 million in grants to 23 projects. And this slide provides a snapshot of what the entire portfolio of 28 projects, then including the 23 that received funding on October 17th and the 5 that were selected for MPOX fast tracking looks like. This portfolio of 28 projects under the second call for proposals, this covers 50 countries. The total amount here is 547 million that was awarded to these projects that include the MPOX projects. The total portfolio, $547 million awarded, has resulted in a leverage ratio of 7.3, which is every dollar, which means every dollar of grants that was awarded have managed to mobilize $7.3 of additional co-financing and co-investment. This portfolio cuts across all 6 World Bank geographic regions. 74% of these projects are for low and lower middle income countries. 50% of the allocation is for sub-Saharan Africa. There's a good mix of implementing entities with excellent collaboration across these entities. 96% of them have a One Health focus. They are actually operationalizing One Health approaches on the ground, bringing together ministries of health, finance, environment, agriculture, animal husbandry, ensuring that in everything that they're doing, they're taking a One Health lens. In other words, recognizing the close nexus between animal health, human health, and the environment, So just to give you a few examples, if it's on the workforce side, these projects are helping to build capacity and provide training, not just for doctors, nurses, but also for veterinarians, for animal health workers, setting up veterinary training institutes, then strengthening the capacity of lab technicians, providing training programs, field epidemiologists. So, that's just on the workforce side, but also on the labs, for example, when they take a One Health approach, what they're doing is they're upgrading both veterinary and human labs and then connecting veterinary labs with human labs. Surveillance, there's a strong focus on zoonotic disease surveillance and so on. 93% of these projects are tagged for gender. In other words, they're taking a gender lens in the way projects have been designed and also are being implemented. And most of them cover AMR surveillance, recognizing AMR as a silent pandemic. And I know there's a lot of data on these slides, so we can share them with you later, and please have a look and get back to us if you have any questions. Next slide, please. So this just gives you a snapshot of the overall portfolio now from the first and the second call for proposals. So we have a total of 47 projects covering 75 countries, 885 million allocated. That's leveraged 3.7 billion in co-financing and 2.4 in co-investment, with an average leverage ratio of 1:7. So every dollar that's been awarded has managed to catalyze an additional $7. And these projects span across all geographies, income levels. They include a range of implementing entities, and again, they have a strong focus on One Health and gender. And as we see our projects roll out, we're really encouraged to see how they're galvanizing collaboration and coordination across different sectors within countries to operationalize One Health approaches, how they're promoting coordination across countries, because many of these projects cover cross-country surveillance, lab strengthening across countries, building country and regional level health workforce that can be surged in the face of a crisis. And they're also taking looking at both regional and local capacity building on health workforce, with a very strong focus on community engagement and civil society engagement. And our first round of projects are already beginning to show some early results, and the second round are still in the process of being rolled out. Next slide, please. And that's my last one. So looking ahead, I've already told you where we stand on the second round of funding. We expect most of these projects to commence implementation in the first quarter of calendar year 2025. And those applicants that were not selected, and there were very many that were not selected, feedback to them is being sent out, and they will have the opportunity to apply in subsequent rounds. The third call for proposals, as I mentioned, will be announced later this month with an envelope of 500 million, and with an allocation decision expected in the last quarter of the next calendar year. We have a results framework which is currently being updated, and we expect that it will be approved in March of 2025. In April, we have a pledging event that will conclude our near-term resource mobilization campaign. Meanwhile, the Pandemic Fund Board, learning from the MPOX experience, is looking at developing a set of emergency financing procedures to help with other health emergencies. That's expected to be approved in June, bearing in mind, of course, that the primary focus of the Pandemic Fund remains on longer-term preparedness and building the capacity of countries to be able to respond to emergencies. So in other words, doing what it takes during peacetime, if there is anything like peacetime, then doing what it takes during peacetime to build the capacity of countries in critical areas like surveillance labs, human resources, with some cross-cutting enablers like strengthening national public health institutes and regional networks, and with a strong focus on One Health, community engagement, civil society participation, health equality, and gender equity. And then lastly, I just wanted to mention that the board also expects that the fourth round of funding will be launched towards the end of calendar year 2025. So there's a huge agenda, there's big demand. The pandemic fund is moving forward quickly, and we were also watching the negotiations that are happening on the pandemic agreement in Geneva, and the board has already made it very clear that the pandemic fund stands ready to and it's well positioned to help with the implementation of the of any pandemic agreement if decided, and in the meanwhile also implementation of the enhanced IHR. So with that, thank you very much. Back to you.
Thank you so much, Priya. That was an incredibly informative presentation of the experience in the second round. We have just a moment if anyone has any questions that they'd like to ask, either through the chat or by raising your hand using the raise hand function. And I see that there's a question from David Castellanos.
Good morning. This is David Castellanos from Honduras. Work for USAID, and I have a question regarding what would be your recommendation, or what, based on the experience for the first batch of countries that receive the were awarded, what are the best practices for coordination with other donors like USAID in this case? Thank you.
Sure. So what we're seeing in these projects is that many of the countries have, taken the initiative to coordinate with the donors who are active in their countries. They have brought in bilaterals as co-investors with them at the project level. But then there are also opportunities for bilaterals to come in as co-financiers, coordinating with our existing implementing entities. I mean, I think the first step is to really ensure that whoever is active at the country level, is aware of the proposal that a country is putting together, and making sure that there's no overlap and duplication. So, I would advise at the country level, in your case, since your question was specifically with USAID, and if they are engaged, then working with them, making sure that they're aware of the country's plans to submit a proposal, bringing them in at an early stage as a co-investor or a co-financier, would be fabulous. So the goal is really to ensure that we together provide a cohesive stream of funding to meet a country's national action plan for health security in a way that all donors and partners, both international and local, are working together.
Thank you so much. We have one more quick question, and then I think we'll have to thank you and move forward. The question was from Ibrahim from Sierra Leone, and he asked when the 6-month priority budget is due.
So from our side, I'm not quite sure I understand the question, but from our side, the funding that these 10 countries under the 5 projects that that the board has selected for MPOX fast tracking, it's all been committed, and it is now with the it's been committed and transferred, and in the process of being disbursed to countries as they ask for it. So it's all, I mean, the money is flowing.
Perfect. Thank you so much. I'd like to thank you on behalf of the Action Package again. This has been really informative, and thank you so much for taking the time to share this with us.
Thank you. Thank you. I'll be listening in, but I'll turn my camera off.
Thank you. Now we will be moving on to a roundtable discussion of country experiences developing pandemic fund proposals, which I hope will also get at these questions being asked about what we've learned about best practices and practical steps. Our moderator for this roundtable will be Abby Lopez Rivera of the Department of Health and Human Services, Office of Global Affairs. And I will turn it over to you, Abby, on behalf of the Sustainable Financing Action Package to introduce the rest of the panel.
Thank you, Julie, and thank you all so very much. Good morning, good afternoon, good evening, everyone. Thank you for joining us today for this webinar on financing for preparedness. And this session will now provide us a unique opportunity to learn from countries that successfully developed their proposals during the pandemic fund's second call for proposals. And so we are joined today by an esteemed panel of experts who led or played a key role on their country's proposal and bring a wealth of experience and expertise to this discussion. I'll introduce now Dr. Nadeen Hilal, who is the advisor to the Minister of Public Health in Lebanon, where she drives health system strengthening projects. She's a rheumatologist and medical educator, and has played a key role in Lebanon's public health initiatives, including leading the pandemic fund proposal development for her country. We'll also have Dr. Anban Pillay, who is the Deputy Secretary General at South Africa's National Department of Health. There he leads the health regulation and compliance efforts and has over 20 years of experience shaping policies, including universal health care coverage in his country. He also serves on the Pandemic Fund Board and advises WHO, UNICEF, and others on equitable access to medicine. And so he is widely regarded and recognized for his expertise in global health and policy development. And we look forward to hearing from him and South Africa's leadership during their G20 presidency. And then I'll also introduce Dr. Reina Teresa Velásquez. She heads the Zoonoses Control Program at the Honduras Ministry of Health and brings 32 years of leadership in the prevention and controlling of zoonotic diseases in Honduras. She's a veterinarian and epidemiologist and has partnered with PAHO and WHO to eliminate human rabies and strengthen zoonotic outbreak responses. And we also have with us Dr. Beza Tekleyohanes, who serves as the technical advisor in the Office of the Minister at Ethiopia's Ministry of Health. And there she oversees the country's pandemic fund project. And so we are really fortunate to hear how their project from the first call is going, which was launched earlier this year. And she also represents the Office of the Chair of the 2024 GHSA Chairmanship, which is held by Ethiopia. Dr. Beza is a trained physician and expert in international public health. And so we are very grateful for having all of you join us today. Today's session will focus on 4 key areas of the proposal development process. That is stakeholder collaboration, which we heard from Priya is a lot of stakeholders and players involved in developing these proposals. We'll also hear a little bit about how they prioritized activities for funding, as well as the financial and political commitments involved in developing their country proposals and private sector engagement. And so through this discussion, we aim to unpack what makes a proposal successful and share the lessons that others can apply to future funding rounds. And we'll begin with a structured discussion and end with some Q&A towards the end. So I encourage our speakers to share freely and provide additional insights beyond the questions we have for today to help enrich the conversation. So starting off with our stakeholder collaboration, and we know effective collaboration is the cornerstone of a strong proposal, and it is particularly challenging in multi-sectoral contexts where ministries, civil society, and international partners must align around shared priorities. And this can be further complicated if you are also coordinating across countries if you're working on a regional proposal, which was the case for Ethiopia and South Africa. So today we'll hear how different countries approached coordination and navigated challenges and leveraged partnerships to create robust proposals. So I want to start off with addressing this question to Dr. Hilal, and then I'll turn to Dr. Pillay. How did your country coordinate with various stakeholders, such as the implementing entities, the various ministries involved, and civil society groups when developing your proposals? Which agency led the coordination process, and what challenges or surprises did you encounter during this process? So I'll turn to Dr. Hilal.
Hello, everyone, and thank you for giving me this opportunity to share with you Lebanon's experience in developing the pandemic fund proposal. So let me start by saying that actually the whole country was sensitized to the issues of importance of pandemic and emergency preparedness. Lebanon for the past few years has been passing through many emergencies, including the COVID pandemic, which it shared with the world, other also disease outbreaks like measles, like hepatitis, and even cholera in the past year, after having been eradicated for more than 20 years. And if anything, this has raised the interest and heightened the alert of the health sector in general about the importance of pandemic preparedness. Now, the first step was convening the committee. And this was brought about by a ministerial decision by identifying the implementing entities, nominated focal points from their teams to sit on this task force, which was assigned by a ministerial decision. And this included the implementing entities, other ministries who are partners, CSOs who are also partnered in this proposal, and key staff from the ministry who were leading on different areas related to the pandemic fund, so mainly human resources, labs, and surveillance. Also, there was the minister's office was represented in this task force. Now, this has supported the work of the team because it demonstrated, first of all, the leadership of the ministry, and at the same time, it demonstrated the partnership between the different partners who were sitting together to agree on one way forward. Now, it's some of the facilitators of this collaboration was that the people who were working on developing this pandemic fund proposal are the kind of people we sit and work with almost on a daily basis. So it was very easy for us to reach consensus because more or less we had similar thinking processes. In addition, what also facilitated the drafting of the proposal is these webinars similar to what we are having today and other educational sessions that the Pandemic Fund Secretariat used to have, and which were very useful for us in drafting our proposal. In addition, we were unsuccessful in the first round. However, the input that we received on the first round was very valuable, and we followed it like word by word until we reached the final form of the proposal. Now, some key points that I would like to share with people who are considering applying for the third round is that, which is based on our experience, is that we need to have realistic and at the same time concrete activities, and it should be really realistic according to the size of the country, its capabilities. So we cannot for us, we prefer to go for few million proposal rather, which we can support by co-investing and co-financing, rather than having a multi-billion proposal, which will be out of our capacity to manage. So this was very important. Some of the key challenges is actually I have two main to list, which is how are we going to distribute the activities among the implementing entities, especially in areas where there are a lot of commonalities, like, for example, things related to One Health. And this also has another related challenge, which is the issue of monitoring. So who will be responsible for reporting on what? Now, this was resolved by continuous discussion and a lot of discussions took place until we were able to reach this consensus. So there were a lot of effort that was made by the coordinator of this task force to break the silos and let the partners work, leave their vertical problems and try to work horizontally as much as possible until we formulate this one plan and one budget. Thank you.
Thank you, Dr. Hilal. That was very insightful, and I think it touched on a lot of the themes that we'll get onto later in the discussion about prioritizing activities and being realistic about what activities we want to implement and of the budget that is needed to do this work. And you touched a little bit on absorption capacity and breaking silos, and so really great hearing from you. I'll now turn to Dr. Pillay with the same question of like, talk us through how South Africa approached this and how did you coordinate across all the stakeholders, all the players that are involved in this process? Oh, Dr. Pillay, we cannot hear you. I think you need to unmute.
Oh, sorry. Thank you very much for the invitation. Let me thank you for organizing this event. I think it's important for countries, particularly that are preparing to put together their submission. Let me say that South Africa is in a similar position to Lebanon in that this was our second application. We did have a few comments in our first round, and we had to address some of those. I think important to say that the team that we assembled were very much similar to the people that worked on the COVID response. So we had a very good working relationship. South Africa is fortunate as a middle-income country that we do have some institutions that are able to support a public health response when you have a pandemic of this nature. So we have a National Institute of Communicable Diseases, as well as a Medical Research Council that does a lot of that scientific work, and they have very strong scientific expertise within those organizations. And we drew a lot on them in trying to put together this application, as well as obviously many members of the Ministry of Health that were part of this, particularly the different areas that were involved in the pandemic response during COVID. We also brought in colleagues from the Ministry of Agriculture as well as Environmental Affairs, and they played an important role in making sure that the various sectors of government are covered in terms of the response. We also tried to deal with the gaps by using the assessment tools, the JE, the STAR, the NAPS, etc., to try and identify where are the areas that we have gaps and to try to implement those. I must say on the implementing entity side, both WHO, FAO, as well as UNICEF, we're very supportive, and when we're called on to be part of the writing team, we're very willing and didn't need much prompting. So we're very fortunate actually in that way. So did some of the delivery partners such as Chai and Japago, who contributed significantly towards writing up this document. So I think from our side, I suppose we're very fortunate in that we had people from all the sectors very willing and capable, and assisted us in putting together a very successful application. Thanks.
Thank you, Dr. Pillay. It's great to hear that even might not have been successful during the first round, but the TAP and the Secretariat were able to share really great feedback that helped you this time around, and also the experience of dealing with health emergencies has established these processes within government and expertise that could be leveraged as you worked on this proposal, and really good to hear that. This question was for everyone, so I also want to turn next to Dr. Beza, and I'll follow with Dr. Reina afterward. But Ethiopia had a single country proposal during the last round. Now you also worked on a regional proposal. So interested to hear thoughts on how that experience with coordination, which is even more challenging on working with multiple countries, and how that took place. And then I would like to hear from Dr. Reina. So over to you, Dr. Beza.
Good morning, good afternoon, good evening. Thank you very much for this opportunity in order for us to present our experience regarding to the Pandemic Fund grant, which we're very much thankful for the past couple of years. So in order to share our experience as briefly as possible, is I can start with how we were able to receive around $50 million or USD grant from the Pandemic Fund, which catalyzed an additional 63 million co-financing and co-investment, which was actually very important in facilitating as well as implementing the project. So we called the Pandemic Fund project the EPPR project on our side. So it was launched on the ceremony of the January 29. So the whole idea of this project was it's more of like a whole of a society type of approach. So exemplifies the Pandemic Fund's innovative approach, what Dr. Priya was actually presenting about previously. So fostering coordination and collaboration across different partners and sectors. So what makes it a bit different from the experience of South Africa is even though we try to engage as much as sectors during the COVID-19 pandemic, we were not able to engage some of the sectors, for instance, the Ministry of Agriculture. So that made it a bit of a new type of engagement when we tried to come up with the proposal in applying for the Pandemic Fund project. So we tried to engage the Ministry of Agriculture, the Ethiopian Public Health institutions, Army Hansen research institutions, and animal health institutes. And as an implementing entity, we tried to engage the WHO, FAO, and UNICEF. And there were also academic institutions and CSOs. So that made our proposal very successful, thankfully. And there are also other international organizations from delivery partners as well, such as CHAI, Resolve to Save Lives, AMREF, and Ohio State University. So these are for the delivery partners. We actually engaged during the proposal writing, and we're currently working with for the first phase of for the first application for the first phase of the grant. So we're very much thankful for the success. And when it comes to the stakeholders collaboration, those are the partners that we leveraged on actually using. And when it comes to developing the proposal for the first grant was we tried to prioritize activities based on try to be very evidence-based and data decision making, in activities, which I genuinely close to be getting using this fund. So by following the requirement of the Pandemic Fund, we also try to go through our assessments as a country where the joint external evaluations, the GA or the National Action Plans for Health Security, and we try to take those lessons from the COVID-19 response effort as well. And then we try to incorporate all those things in incorporating the activities for the application of the first application. So adding on that, we actually focused on the co-investment and co-financing because that was the major area that we understood from the Pandemic Fund the application. So the co-financing included contribution from Ethiopian government as well as support from the international partners like I mentioned before, the WHO, UNICEF, and the FAO. So this collaborative approach ensures robust and sustainable investment. So even for the continuous functioning of this implementation of this grant, even this implementing entities has been very helpful in providing technical support as well as the co-financing and co-investment we discussed. So regard to the second applications, majority of the things has been actually explained by South Africa. We went through similar path, so not to say similar things again and again. I would like to just emphasize on the role of IGAD, or the Eastern and Southern Africa Health Nutrition Security. Actually the organization has played a significant role for the regional pandemic fund. They were able to facilitate regional collaborations, coordinations among countries. So regional coordination includes regions to align their proposals. We were able to work with different countries, such as Djibouti and other countries that we've applied with. So working together on a joint applications makes everything much more productive. Also, it makes you think more than a country, make sure that make sure to consider other countries and how we can be benefited from cross-country working on a cross-country level. So ensuring this unified type of approach to the preparedness and response has been very instrumental. So additionally, the technical support has been very, very valuable as well. Technical expertise, guidances to countries were actually given from the IGAD representative resource sharing capacity buildings. So these are the ways where we were able to get as much as we could from the certification as well. So thank you very much. This is regarding the questions that I asked. Thank you very much.
Thank you, Dr. Beza. That was very insightful. It was very encouraging to hear that the pandemic fund proposal process strengthened some connections with the Ministry of Agriculture that weren't really there before, and some of those animal health institutions. And you touched on the co-investment, co-financing, and how that was a big focus of your efforts. And I want to dive a little bit deeper on that later on in our discussion. So I'll come back to you about that. And like hearing about how you worked on the regional proposal and how IGAD was able to facilitate that is, I think, a really helpful pointer for other countries to really leverage those regional organizations. We've heard before from the Caribbean Public Health Agency, another regional organization that facilitated that coordination amongst Caribbean countries that got funded the last round. So it's something for us to pay attention to when we see other regional organizations like ASEAN, SADC, and others that can help countries and facilitate that coordination amongst countries for regional proposals. I want to hear from now turning to Dr. Reina, who comes with us with a lot of expertise on One Health and zoonosis, and perhaps hear more about how you led your efforts in your country. And Doctora Reina, hacia usted, te doy un momento para que pueda entender.
Muchas gracias, Abby, por la oportunidad de compartir con ustedes lo que es la experiencia de Honduras en lo que fue la preparación de la propuesta y que realmente ese esfuerzo se vio retribuido, ¿verdad? Ya que fue aprobada dicha propuesta. Quiero comentarles que para elaborar esta propuesta se elaboró un equipo petit, ¿verdad? Donde se elaboró un plan con hitos estratégicos para garantizar una propuesta sólida, centrada en fortalecer capacidades, sobre todo multisectoriales, en preparación, prevención y respuesta ante emergencia sanitaria, y se basó sobre todo en un esfuerzo multisectorial desarrollado en el año 2023. Les comento que en ese año, con el apoyo de los CDC, se hizo lo que es la priorización de enfermedades zoonóticas en el país, y esto permitió, ¿verdad?, involucrar a varias instituciones, tanto de sector salud humana, animal y ambiental, y la academia también. Y también, una vez que esto se hizo, se elaboró un plan de priorización, un plan de acción con un enfoque integrador de una salud sustentado en ese proceso de priorización y permitió identificar riesgos claves a través de un análisis exhaustivo, ¿verdad? Que orientó a lo que es fortalecer la capacidad de vigilancia, mejorar la respuesta a brote, avanzar en la planificación de preparación, consolidar la prevención y el control de enfermedades. Y esta integración de estos actores con el enfoque de una salud se ha venido fortaleciendo a través de la implementación de un mecanismo de coordinación multisectorial que agradecemos a USAID el apoyo que a través de todo este tiempo nos ha brindado en el establecimiento de este mecanismo donde estamos integrados todos los sectores de una salud. Esto facilitó, ¿verdad?, que nos integráramos para la elaboración de esta propuesta también. Hemos tenido desafíos, ¿verdad?, como es lo que es alinear las agendas sectoriales y garantizar lo que es la participación balanceada de todos estos actores. Y bueno, tuvimos la respuesta positiva y sobre todo el compromiso del nivel, alto nivel, a nivel de todos los sectores, ¿verdad? Con un enfoque coordinado y robusto en cuanto a este aspecto. Entonces, realmente esta coordinación se ha venido fortaleciendo. Ahorita estamos trabajando en lo que es la legalización de este mecanismo de coordinación multisectorial para que nos ayude a la implementación realmente de este proyecto de fondo pandémico. Gracias.
Muchísimas gracias. Entramos en lo de la priorización de actividades, muchos detalles que has compartido con nosotros sobre, y este en particular, la legalización del mecanismo Una Salud, que mi jefa Ana seguramente está aplaudiendo al escuchar eso. Y como ustedes llegaron gracias al CDC y otros a poder priorizar la priorización de las actividades en el país, identificando esos riesgos y cómo llegaron a esas decisiones. I hope everybody is understanding. The discussion is following along with us on Wordly. I just wanted to remind our audience to please open up that app so that you can follow a conversation in both English and Spanish and the language of your choice. I will now go to this challenging aspect of proposal development, which is deciding what activities to prioritize for funding. And we know national action plans are meant to help facilitate this decision, but can make it rather complicated with a long list of recommended actions. And the pandemic fund, as you know, prioritized laboratory surveillance and workforce development during these last 2 rounds of funding, but there are so many activities that we could do under these 3 areas, whether it's IPC, biosafety, biosecurity, data integration, you name it. There are many activities that could take place. There's a lot of balancing of the immediate needs and the long-term needs and alignment that needs to take place. Dr. Reina spoke to the challenges a little bit with aligning the priorities of various ministries, as well as the participation of all of them. And so that needs to take place, and it's very critical. And so I want to explore now how countries navigated these difficult decisions, and would like to turn to Dr. Pillay to help us go a little bit deeper on how did you, like, what guided your country's decisions on the activities to prioritize, and what informed these priorities, if any particular assessment, and going a little bit further on the specifics of those activities and those difficult decisions that needed to be made. Over to you.
Thank you. Yes, I think it's always going to be a difficult decision, simply because at the end of the day, there's only a limited amount of funding available, and thus a limited amount of activities that that can be financed. And so we divided ourselves into 3 areas as required by the pandemic fund in terms of the areas that that will be funded, which is surveillance, labs, and human resources, as you pointed out. And each of the teams then looked at what are the activities that could be included in each of those areas, and how best we could actually structure a proposal within the budget that would be available. So there was a lot of debate, and I think that took most time, because you could quite simply just sit down yourself and write out a proposal based on the gaps that you have in your NAPS or your JE and STAR, etc. But at the end of the day, it's about what's the priority, right? And that's always going to be the debate between the health ministry and the agriculture ministry, our colleagues in the sciences, such as the National Institute for Communicable Diseases or the Research Council, etc. So I think that's always going to be a debate, but fortunately, I think everyone at the end of the day appreciated that one needs to give and take in these processes, that priority setting requires you to compromise on some of the things that you may have wanted, but you couldn't do, simply because you must remain within a budget which is available. And there's always an opportunity after implementing these activities that the other activities that are proposed can then be implemented. So I think it's an important question, and it's probably the area that most applicants spent their time on, simply because of the diversity of interests and views from the different ministries as well as implementing entities as well. Yeah, thanks.
Thank you. It ultimately turns into a political decision, deciding where to allocate resources and on what activities. Dr. Hilal, you touched a little bit on this in your earlier comments. I want you to come in and speak a little bit more into that prioritization that took place in Lebanon. And I think you mentioned that it's kind of touched on the activities that need to be funded and whether the country being realistic about the project and the implementation of the project. Can you come in a little bit more and talk to us about Lebanon's experience here?
Yeah, sure. So what helped us in the drafting of the proposal is that we had a national health strategy, which we launched early 2023. So it was relatively recent, and it had prioritized pandemic and emergency preparedness. And we have several activities under this pillar. Aside from this very important pillar, we also had cross-cutting themes that we have prioritized in our national health strategy, like digitalization, like human resources strengthening, the things that you were also mentioning, like including investing in essential public health functions, reviving the reference lab. So we know what our priorities are based on our national health strategy and other strategic documents. Just for the sake of time, I will not talk about all the strategic documents. On the other hand, we had the assessments, and while writing the proposal, we had to review all the assessments we had, like JEE, the SPAR, and other assessments, which has more or less highlighted our gaps and deficiencies in the system that we need to fill in with the activity that we are going to prioritize. The third set of data was the country indicators, the health country indicators that we had in general. So our proposal was the product of data triangulation from our priorities, the gaps, and the country indicators. Again, like the previous panels just mentioned, we had a lot of activities that we need to prioritize among the priorities again. So we did another round of prioritization until we all agreed that these are really our priorities. Now, again, we had many challenges here because, as you know, Lebanon is passing through unstable geopolitical situation. We had the war, which now, thank God, we have now ceasefire. But at that time, there was already escalation in the security threats and the attacks. So one of the main challenges to us was how to balance between development and humanitarian, especially at times of conflict. So the pandemic fund is more towards development, whereas we need really humanitarian funds to be able to provide essential services. And I'm talking specifically about this because whenever we want to commit, whether us as the government for co-investment or whether the partners as co-financing, we need to keep up with our promises. So we cannot just commit in the pandemic fund and then withdraw after So this was really challenging, but despite all, we committed that we want to do it, and we are going to invest in system strengthening despite the humanitarian crisis that we have, with the thought of that after we are out of this crisis, we want to, as we always say, build back better. So we want to go out of this crisis with something that will help our system sustain.
Thank you, Dr. Hilal. That's a very important perspective to share, given that many countries right now find themselves in similar crises and in dealing with humanitarian conditions, and it's not easy being able to balance those preparedness needs with ongoing humanitarian needs. And that's a really challenging predicament to find oneself in, and certainly affects our country's ability to fulfill on their commitments, right? And I'll transition a little bit towards that part of the conversation now, where financial and political commitments are a huge part of the Pandemic Fund project, where co-investment is needed from countries and co-financing from implementing entities, and these are expected commitments and proposals. And so these commitments signal a country's readiness and ownership of the project, and they demonstrate a commitment to sustainability and ensuring that funded activities have lasting impact. And I want to have a discussion about the factors that influence these commitments and the steps needed to secure them. And Dr. Hilal shared some of those ongoing realities, and I want to go a little bit deeper into that, but turning to Dr. Beza and Dr. Reina. But first, I'll turn to Dr. Beza. What are the factors that guided your country's decision on financial or political commitments? You shared a little bit about this earlier in your comments. Can you give us a little bit more insight if there were any significant challenges in securing that level of co-investment and co-financing, which was huge, almost half of what you were receiving in the pandemic fund, or maybe perhaps more, that is being co-invested and co-financed for Ethiopia's project. Over to you, Dr. Beza.
Bueno, quiero compartirles que realmente en Honduras, digamos, en relación al tema anterior, algunos de los factores que influyeron en la toma de decisiones de qué actividades vamos a priorizar, consideramos los instrumentos de autoevaluación para la presentación anual de informes de los Estados miembros del SPAR, basados en lo que es el Reglamento Sanitario Internacional, en sus 15 capacidades, ¿verdad? Y la propuesta estuvo considerando la identificación de estas brechas e intervenciones específicas para mejorar esas brechas que se identificaron. Se consideró también lo que es la evaluación de la prestación de los servicios veterinarios. Sabemos la importancia de este análisis, y evaluación de la calidad interna y externa de la capacidad de los laboratorios, los planes de preparación y respuesta, y con que contamos las funciones esenciales de la salud, y qué desafíos encontramos realmente en cuanto a esto. Realmente, ¿verdad? No contamos con una evaluación externa del Reglamento Sanitario Internacional de los Servicios Veterinarios y también esperamos realmente la sostenibilidad a través de una planificación conjunta dentro de este mecanismo de coordinación multisectorial, ¿verdad? Hemos discutido lo que es la importancia de vincular los recursos nacionales con esta asistencia técnica y financiera internacional que estamos teniendo para ver lo que es la sostenibilidad, incluyendo los departamentos de planificación y administración de las instituciones involucradas. Hemos identificado también la Secretaría de Finanzas como ente importante en lo que es la sostenibilidad de estas acciones también y llevar a cabo la sostenibilidad a través del fortalecimiento de los niveles a nivel de la implementación de los planes a niveles departamentales, municipales y locales, ¿verdad? Fortaleciendo lo que es la participación social, participación comunitaria, la coordinación intersectorial y esta misma gestión entre la Secretaría de Finanzas para ver presupuestos para el financiamiento de objetos prioritarios como es recursos humanos y la capacidad de laboratorio en nuestro país de forma que nos permita realmente que estas actividades sean sostenibles y desarrollando sobre todo la capacidad local en los diferentes sectores que conforman una sola salud. Gracias.
Gracias, doctora Reina. Y como estamos cortos en tiempo, te quiero mantener aquí para que también nos puedas decir, pudiste compartir con nosotros esa relación que tenían que desarrollar con el ministro de Finanzas. ¿Me puedes hablar un poquito más de cómo es que lograron convencer a ese ministro que estas son las prioridades y que ese financiamiento es necesario para la sostenibilidad del proyecto? Y incluso si me pudieras también comentar lo que tienen contemplado con el sector privado.
Básicamente, digamos, con el sector privado, lo que tenemos contemplado es involucrarlo en toda la implementación de este proyecto. Ellos actualmente en muchas actividades, ellos están involucrados, pero queremos ahora fortalecer toda esa participación a través de las asociaciones de ganaderos y agricultores, asociaciones, patronatos y la empresa privada a través de las asociaciones de avicultores, porcicultores que representan un papel importante también en la parte de salud animal. Tuvimos desde un principio a través de los ministros, ¿verdad? Que ellos se preocuparon por llegar a donde la Secretaría de Finanzas para prestar la anuencia, que ellos prestaran la anuencia para lo que es la aceptación de este proyecto realmente, ¿verdad? Y ahora sí tenemos retos en lo que es trabajar con ellos en todas las actividades que contempla la sostenibilidad de este proyecto a nivel nacional en todos los sectores involucrados, salud humana, animal y ambiental, porque eso es el enfoque, ¿verdad? Por eso mismo nuestro proyecto lo dice, ¿verdad? Con un enfoque de una salud y en el marco del Reglamento Sanitario Internacional. Avi, gracias.
A ti, gracias a ti. I want to hear from Dr. Beza. we're having challenges hearing each other. But turning to you, we're short on time, but please tell us how you worked to secure your financial and political commitments for your project.
So I've tried to give a little bit brief about how we were able to secure the co-financing and co-investments. So those are very tricky tricky terms, and as a country we were very strict about it. We were very strict, and at the same time we were very we tried to operationalize what we meant by co-financing and co-investment when it comes to any grant, specifically this grant, the pandemic fund grant. So we were fortunate enough, just like you said, we were able to receive more than the amount of money we were granted from the pandemic fund, which was, for example, 63 millions from the World Health Organizations. Being able to get that sort of commitment from the organization were very successful. But after the fund was granted, making sure that that co-financing is actually not confused with co-investment is actually the one area that's supposed to be well taken into consideration. And our office actually worked so hard in to have a continuous follow-up. We have a well coordinated coordinated system where we are able to overlook into the technical working groups, into the steering committee and the joint coordination committee, where we ensure that this co-financing and this co-investments are not being misunderstood. They are going to be ensured there as they were committed initially while applying for the grant, and all the investments or all the financings are going to be able to complement the areas that are supposed to be supported to the country, not to the Ministry of Health. One thing that we were very clear from the initial setup is that this is a country project. So we took it as a country project, not only a Ministry of Health project. So that means even though the Ministry of Health were able to chair, let's say, the highest level meetings, which is the Joint Coordination Committee meetings, it's actually co-chaired by the Minister of Agriculture. So we wanted to make sure that that sort of alignment is actually ensured from the sectors, which is the Minister of Health and the Minister of Agriculture, and knowing that this project belongs to a country, not to a specific sector, was actually something that we want all the sectors that are involved, including the delivery partners, implementing entities, the government entities, to understand. So by that, we were able to follow up on the co-financing and the co-investments very strictly, and so far it's going well. I hope I've tried to answer the question as briefly as possible. Thank you.
Yes, thank you so much, Dr. Beza. And we really are at the end of our time, but I want our panelists to be able to share maybe 30 seconds of final thoughts, any recommendations for future rounds, whether it be for the pandemic fund or to countries, and what do you think is the most important thing they should take away from our conversation today and from the experience that you've shared. So I just want to go around. So to Dr. Pillay, please, 30 seconds. And I want to hear from everyone. Thank you.
Thank you. Yeah, I think it's most important to assemble a good team that represents the various sectors that are involved in the pandemic response. And I think if you have a good team that is keen on making sure that we deal with the next pandemic, if it was to arise, then you would probably be able to put together a very good application. So I think a team building is probably the key issue. I think everything else falls into place once you have a good team in place. Thanks.
Thank you. And Dr. Hilal, and then Dr. Reina follow. Dr. Hilal, are you with us? All right, I'll turn to doctora Reina. 30 segundos.
Bueno, yo agradecería realmente, ¿verdad?, esa retroalimentación que da el Fondo Pandémico a las propuestas donde uno identifica realmente las debilidades que uno tuvo en propuestas anteriores, ayudan mucho para mejorar las propuestas que uno presenta posteriormente. Yo creo que eso es un elemento valioso y agradezco por parte de Honduras diferentes instituciones y organizaciones que nos apoyaron en la elaboración, OPS, BID, USAID, en la elaboración de esta propuesta, UNICEF. Muchas gracias.
Gracias. That was a really important point that was shared by others, how the feedback from the pandemic fund on those proposals was really important for the second time around and being successful. Dr. Beza, final thoughts from you.
So pretty much everything has been shared by other panelists. So I'll try to put a certain recommendations where we will be able to strengthening a certain collaborations globally and regionally, where countries will be able to learn from each other. For example, this kind of platforms which we have through this GHSA is actually great, establishing regional networks in order to share resources, including facilities or best practices and experiences is very important, and enhancing communication channels. Could be regular communications or real-time data sharings. That would be very nice that regions in general should work in order to motivate their countries and being able to successfully grant this type of fundings and other funding. So besides on a country level recommendations, which I've already shared so much about, I would suggest that this could be a great areas where countries could collaborate, working on a regional level in coordination and collaborations for countries to learn from each other and help each other for a unified strategies and policies and all, and harmonizing those policies as well. Thank you very much.
Thank you, Dr. Beza. And that's certainly what we aim to do here in GHSA, and being able to share those lessons and practices. Really grateful to you all. I want to turn it to Dr. Jose for our closing. Thank you all.
Thanks so much, Abby. And well, that was a fantastic discussion. A lot of great insights from our presenters. And I think that I agree with you. It does underscore the value of GHSA in bringing these kinds of conversations together in a very diverse group. I think I'll just do a quick wrap here. I know that we're a few minutes over, but I just want to underscore how valuable I think Priya's presentation on the pandemic fund, and sort of really seeing a lot of the details of the process. I think very helpful again to lay that out very clearly for everyone. And I've personally found that very useful and interesting, and I hope others did as well. From the roundtable discussions from our four panelists, I heard a lot about themes of strengthening or building on existing multi-sectoral coordination mechanisms, which is incredibly important. Some of those developed during COVID, and some of those actually new collaborations, and seeing this proposal development process as an opportunity to build new connections with different sectors that others hadn't been connected with already. So that's a great effect of this whole process. We also heard about the need to be realistic about the kinds of projects being put into a proposal and the funding that would be required. And this got us into some discussions also around the need for prioritization of priorities, right? But prioritization of the kinds of projects we're thinking about across sectors, and really working amongst sectors, the sector partners, to be able to come up with an agreed upon set of priorities and projects to put in the proposals. Was also noted about the importance of the role of implementation partners, implementation entities, the bilateral partners, and others in the whole process of proposal development and really leveraging the collective expertise and capabilities of all the partners together. We heard also about the benefits of leveraging existing assessment tools like those found in the IHR Monitoring and Evaluation Framework, the SPAR, the JEE, but also taking into account the existing strategies that governments have and using that collectively to guide prioritization efforts. And then, of course, this whole issue around balancing the needs and interests and the participation of the participants in the participating sectors and coming to an agreement on what is needed by the country and how best to frame that and put that in a proposal. And so a lot of focus then on what benefits the country overall and coming together in one approach. And lastly, I think we heard this at the beginning and also throughout is the importance of leadership engagement and particularly the political leadership and the support at the start, as well as where the some challenging decisions need to be made and leveraging that as that political support and political leadership as well. So in closing, I just want to thank the Advocacy and Communications Task Force for their support in organizing this event, and certainly to Priya Basu from the Pandemic Fund Secretariat for her presentations, Dr. Hilal, Dr. Pillay, Dr. Tekleyohanes, and Dr. Velásquez as well for all of the experiences that they shared with us today, and a special appreciation to Abby for moderating the discussion as well. And thanks to all who joined today. As the next step, we'll follow up with a meeting report, and the event recording will be made available on our website soon. So thank you all once again, and I'll turn things back over potentially to Julie, just to send everyone off. Thanks so much.
I think we'll end here. Thank you so much. And to all, a great day. We appreciate your time and attention to this webinar. Take care.